All right. Hey, it's Huntington disease, Todd. Hey, today's show is we're going to be talking about the S word. That's right. Better grab the kids. Today's brought to you by the letter S. We're going to talk about, hold this up, the S word. I know you might want to cover the kids' ears. Get ready. We got to cover it though. Shower. Boring. Hey, it is kind of something that happens that none of us really want to deal with. But personal hygiene becomes something that becomes less, important as you get along with Huntington's disease. And I'll just talk again from my personal experience. Back in the old days when I worked and when I had a, full-time job and when I would get up every morning and go out to the workforce and all that, I would take a shower. I never even thought nothing about it. But something happened somewhere along the way, probably in my 50s, mid 50s. That just became something that wasn't that important to me. Taking a shower became less, of an important thing. So also, it happened with my mother. It happened, and I remember when the care person was there with my mother, he said, look, all those oils that our body builds up, they're kind of, good and protective. And, taking a shower every day isn't all it's cracked up to be if you want to know the truth. So if you, get in that malaise or that habit, or you see your, loved one or whoever not, taking as much attention to their personal hygiene, just understand it's part of this disease. Again, I used to, religiously did all that care, getting ready for work. I would do all those things, before I would go anywhere, do anything. So today's word, the S word, is definitely, it's about showering. It's about hygiene. It's about taking care of those. So for the family members, just remember that Huntington's disease is, again, the thing in our brain that makes us think different, do different, act different, be different, all those different things. It's not us. And it's not something that you can get mad about or, throw a fit about or say, hey, I wish you would. I wish you, it's just part of what it is. When I started this video process a few months back, I was actually missing one of my front teeth. I was, not that concerned about it back then when I was sitting around my house and nobody was really seeing me ever. But, when I started doing these videos, I thought, well, dang, that looks a little bit, but anyway, that's another thing that happens too with Huntington's. You lose your, a lot of people lose their teeth. My mother's teeth were gone. My brother's teeth were gone. I never wanted to get dentures, but I do have a partial, or maybe more than one. But the point of it is, personal hygiene, our body starts acting us different, treating us different, and so we start acting and treating ourselves different. Nothing personal or none of that. So I just wanted to kind of pass this on today as we talk about the S word. Showering and taking care of that kind of thing becomes less important. I will say, though, for today's video, I took a shower. So it always feels nice, and I always enjoy it. And, for the letter S, today's, what's that show called? Sesame Street. We're going to be talking about the letter S. So this video is just a little bit more about things that happen when you have Huntington's disease, and the person that has it can't do much about it. And the people around us just need to be a little bit more patient. Don't freak out. Don't overly worry. As long as you don't have to sit too close to us, it ain't going to matter anyway. Stinky Todd here. So today's episode is brought to you by Stinky Todd. Like one of those Sesame Street characters, I'm sure. One of them had to be, the guy in the garbage can. Yeah, he was kind of like that. So anyway, Huntington's disease, Todd, if you would, and don't forget, take a shower sometime this week or within the next few weeks, if you would. All right, that's today's show. Huntington's disease, Todd. Subscribe and get notifications. All right, have a good day.